Okay, good morning, everyone. Can you hear me okay, Hillary?
Yes, yep.
I'm Lisa Grennan. I'm the Family Program Manager for MWR, and today we are presenting Social Security retirement planning today for tomorrow's future. And we're so fortunate to have Hillary Hatch with us. She has been with Social Security for 15 years. She holds a master's degree in, excuse me, in public administration from Grand Valley State University, and she works as the Social Security administration as their public affairs specialist. Sorry for the confusion today. Social Security a couple weeks ago let us know that they are under a continuing resolution, so did not have funding to send Hillary to us, which we had been planning on. So sorry for the confusion, and we had folks in the Palm Garden room, so just trying to make sure everyone's connected. So thanks for hanging in with us. Take it away, Hillary. Welcome.
All right. Thank you so much for having me. I will be pausing throughout the presentation to check in with Lisa to see if we have any questions. So feel free to put those in the chat. And then, of course, at the end of the presentation, too, I'll stay on and answer any questions that come in. And if there's any questions that I can't get to or I don't know the answer to, I will be sure to jot those down and send those to Lisa so we can provide you with a response to your questions. So with that, I will go ahead and get started. Today, I'm going to be talking about Social Security retirement benefits, survivor benefits, touch a little bit on Medicare, and then also talk about some of our online resources. The number one question that we typically get at Social Security when it comes to retirement is individuals wanting to know, when is the best time to retire? And there really isn't a one best time for everyone. There's only a right time and a right age for you. The decision is such a personal decision. There's so many other factors that go into it. But I am going to cover some things to keep in mind so it will help you gauge when the best time or the right age for you to file is going to be. So, one thing to keep in mind is that your monthly retirement benefit will be higher if you delay starting it. It will be lower if you start your benefits early. Married couples have two lives to plan for. So, if your spouse is eligible on your record, or you could receive benefits off of your spouse's record, and you're ready to retire, but your spouse isn't, all of those scenarios could come into play. You can keep working and get Social Security benefits, but there is an earnings limit, and that's something I will talk about. Your benefits will be subject to taxation. Well, may be subject to taxation, but they probably will be. And then also Medicare is something else we're going to cover today. So, how do you qualify for retirement benefits? By earning credits when you work and pay your Social Security taxes, that is how you become entitled to Social Security retirement benefits. So, credits are like the building blocks that Social Security uses to find out whether you have the minimum amount of covered work to qualify for each type of Social Security benefit. So, in order to qualify for retirement benefits, you need to have 40 credits or 10 years of work, and you must be 62 or older. And a credit is based on a dollar amount of gross earnings. So for this year, 2024, the amount to earn one credit is $1,730 in gross earnings. And the maximum number of credits you can earn per year is 4. So to earn all 4 credits this year, you must earn at least $6,920. That's how you earn your 4 credits. Doesn't matter when you earn them, if it's all in one month, if it's over the course of the entire year. Also, when you are earning credits, you never lose those credits. So if you started working maybe at a young age and you left the workforce for a while to care for a family or parents or whatever the case may be, when you re-enter the workforce later on, any credits that you had before, you still have, so they'll stick with you. So really the takeaway here is you need 40 credits or 10 years of work, and you must be 62 or older to qualify for a retirement benefit off of your own work record. So Social Security determines your benefit through a 3-step process. So your wages are adjusted for changes in wage levels over time. We find the monthly average of your 35 highest earnings years, and the result is what we call the average index monthly earnings. So, this total process is called indexing. We do use the monthly average of your 35 highest years. If you don't have 35 years of work, that's okay. Let's say you only have 25 years of work. That's fine. That means we're going to use all 25 years, but then we're going to use 10 zeros in the calculation because we always use 35 earnings years. So here's an example of how indexing works. So if you look at column C, it has index factors listed. This is going to be different for each person because it's based on your year of birth. So your indexing factors might not be the same as what you see in this example because it's based on your year of birth, but it will give you an idea of how indexing works. So for this example, this individual made $10,000 in 1991. Those were the actual earnings. When we multiply it by that index factor, that 2.55 number, the result of the indexed earnings is $25,504. So the indexed earnings is the amount that we are using in the calculation. So when we pick out those high 35 years, we're looking at the indexed earnings and not the actual earnings. So sometimes we do get questions about special credit for military service. From 1957 through 2001, if you had military service earnings for active duty, you may have extra Social Security wage credits added to your record. So from 1957 through 1977, you are credited with $300 in additional earnings for each calendar quarter in which you received active duty basic pay. And then from 78 through 2001, for every $300 in active duty basic pay, you are credited with an additional $100 in earnings, and there is a maximum of $1,200 a year. In 2002, the law changed, and so extra earnings are no longer apply from that point forward. But I do want to mention here that when you apply for benefits, we automatically verify your military service. So if your military service increases your benefit and we cannot get proof of your service, we will ask you for your DD 214 or other proof of service before we process your application. And in all cases, we add the military wage credits to your earnings and not directly to your monthly benefit amount. One thing that is extremely important to know is what your full retirement age is. And your full retirement age is based on your year of birth. Why is it so important to know when your full retirement age is? It's because that's when you're going to receive 100% of your Social Security benefit. Again, if you start collecting it before your full retirement age, it's going to be reduced. If you wait until after your full retirement age, it can increase. So for individuals born 1960 or later, the full retirement age is age 67. That's when you would receive 100% of your Social Security benefit. If you start collecting at age 62, which is the earliest that any of us can collect, you would only receive 70% of that benefit. And from the time you are full retirement age up until age 70, you can earn what we call delayed retirement credits. So for someone born 1960 or later, if they wait until age 70 to collect their retirement benefits, that percentage is 124%. So just something to keep in mind, knowing your full retirement age is important because the earlier you collect, the less that you're going to receive. Now, here's an example of what I just talked about, but using dollar amounts. So for this example, this individual, their full retirement age is age 67. At age 67, their benefit amount is $1,000. If this individual starts collecting, let's say at age 62, their monthly benefit amount is going to be $700. Now, let's say they wait up until age 70. you can see how the benefit increases there because they've earned those delayed retirement credits. So the increase results in a monthly benefit amount of $1,240 per month. Now, once we reach age 70, our benefit does not increase anymore based on our age. So there would be no point in delaying in taking benefits at age 70. No one has to file for Social Security at any time, but if you wait until past age 70, it's almost like you're losing out on money. So you would definitely want to file, at age 70. These amounts that we're showing you in this graph, they show yearly amounts, but it's actually monthly. So every month that you wait to collect a benefit, the higher it will be. So for example, if this person started collecting at age 62, the benefit amount is $700 per month. If they wait until age 63, it's $750 per month. But let's say they file at age 62 in 6 months. Well, then the benefit amount is going to be somewhere in between the 700 and the 750. So each month that you wait to file, the higher the benefit will be. Also, it's important to know that once you do file and start collecting, you're locked into that amount. So if you started collecting at age 62, once you reach your full retirement age, the benefit amount doesn't go up to that full retirement age amount. Once you file and start collecting, you are locked into that amount. So next I'm going to transition into benefits for spouses and then benefits for divorced spouses, and then I will check in to see if there are any questions. When it comes to benefits for a spouse, the maximum that a spouse can receive is 50% of the worker's unreduced benefit. There is a reduction for early retirement. If the spouse's own benefit is less than 50% of the workers, they will be combined to equal 50% of the workers. It does not reduce the payment to the worker. The benefit is unreduced if the spouse is caring for worker's child younger than 16 or disabled, and spouse benefits are not payable until the worker collects. So let's say my husband has a benefit at his full retirement age of $2,000. As a spouse, the maximum that I can get is half of that. So the maximum I can receive is $1,000. That's if I start collecting at my full retirement age. If I start collecting early, I'm not going to be due that full $1,000. It's going to be reduced, and the reduction is just going to depend on my age at the time I start collecting. Let's say I am due benefits on my own work record as well. If the benefits on my own record are higher than half of what I could get on his, I'm not due a spousal benefit. So if I'm due, benefits of $1,200 per month on my own record, I can't collect the $1,000 off of his because my own benefit is higher. But if it is less than 50% of his, then it will be a combination of the two to equal 50% of his. So if the benefit on my own record is $700 per month, I could collect the $700 off of my own record plus an additional $300 spousal benefit, and the combination of the two equals that 50%. If I am collecting off of my spouse's record, it does not reduce his payment at all. So it doesn't impact anything that he would get off of his record, but I cannot start collecting until he starts collecting. So I do have to wait for him to file and collect in order for me to get that spousal benefit. The one exception to the benefit not being reduced because of age is if I were to be caring for a child younger than 16 or a disabled child. So I could start collecting benefits as early as age 62, and there wouldn't be a reduction in my spousal benefit because I'm caring for a child under 16 or a disabled child. Benefits for divorced spouses, pretty similar rules. Jumping ahead there. Pretty similar rules, but there are some differences. So you can receive benefits on your former spouse's record, even if he or she has remarried. If the marriage lasted at least 10 years, you are unmarried, you are age 62 or older, your ex-spouse is at least 62 and eligible for Social Security benefits, but they do not have to be collecting. And the benefit you would receive based on your own work is less than the benefit you would receive based on your ex-spouse's work. So we still look at that 50% rule. That's the maximum you can collect as an ex-spouse. If the benefit on your own record is higher than that, you can only get on your own record. If it's less than that 50% amount, you would collect benefits on your own record plus an additional ex-spousal benefit, in the combination of the two would be that 50% amount. That's if you're filing at your full retirement age. If you file early, there's going to be a reduction. The reduction just is going to be based on how old you are at the time that you start those benefits. If you are an ex-spouse, you collecting benefits from your former spouse's record does not impact their benefit at all. And if they're remarried, the new spouse is collecting benefits off the record, it doesn't impact that amount either.
Hillary, we have a couple questions.
Okay.
So if my wife has never worked outside the home but reaches her full retirement age and I pass away, she will receive half of my benefits, correct?
So she would be due a survivor benefit, and that's something that I'm going to talk about. So if you were to pass away, she would receive 100% of your benefit at the time you passed away. So I'll get into that when we talk about survivor benefits.
And the other question is if are we able to share your slides with people?
Yes, absolutely. You can send those out.
Okay, great. Thank you.
So one more thing about spousal benefits and divorce spousal benefits is that as a spouse or an ex-spouse, you are due 50% of the worker's benefit amount at their full retirement age. So let's say my spouse at his full retirement age, his benefit amount is $1,000. I can collect 50% of that. That's the maximum. But let's say he files at age 62. So he's only getting $700 per month. As a spouse or an ex-spouse, I am still due 50% of that $1,000, not 50% of the 700. And the same is true if we go in the other direction. So if my spouse or my ex-spouse waits until he's 70 to file, so he's getting those delayed retirement credits and his monthly benefit amount is $1,240 per month, I'm still only eligible for 50% of the $1,000 and not 50% of the higher amount with those delayed retirement credits. Again, as the spouse or the ex-spouse, I'm only going to get 50% if I am filing at my full retirement age and the benefit on my own record is less than that 50% amount. Then I would receive a combination of my benefit plus a spousal or ex-spousal benefit, and the two together would equal 50%. We do have benefits that are payable to children. So in order for a child to receive benefits off of a parent's record, mom or dad would have to be receiving Social Security disability benefits or retirement benefits. Or if a parent has passed away, that child could potentially receive survivor benefits as well. So the child must be unmarried, younger than age 18, or up to age 19 if they are a full-time student in high school, or 18 or older and disabled from a disability that started before the age of 22. And when you apply for retirement benefits, we do ask a question on the application to see if there could be any entitlement to children on your record. So the way we word the question is just asking, do you have any minor children or any children that became disabled before the age of 22? And if the answer is yes, then Social Security is going to look into that to see if there is any entitlement due to any children that could be eligible. So when it comes to survivor benefits, again, a child or a disabled child could receive survivor benefits off of mom or dad's record. And then we have widow, widower, or divorced widow, widower benefits. So a widow or divorced widow, widower can receive full benefits at their full retirement age or reduced benefits as early as age 60 or as early as age 50 if they're disabled. at any age if they're caring for a child that is younger than 16 or a disabled child. And remarriage after age 60 will not affect those benefits. So, if you were to pass away, your surviving spouse may claim survivor benefits at age 50 or older if they're disabled, otherwise, at any age between 60 and their full retirement age. And the percentage that they would receive is just going to depend on how old they are at the time they start collecting that survivor benefit. So at age 60, it would be 71.5% of your full benefit, and that's going to increase each month that they wait up to 100% if they start at full retirement age. Um, an example of how this would work is, let's say my husband and I are both collecting Social Security benefits. He's getting a benefit off of his own record of $2,000 per month, and I'm getting a benefit off of my own record of $1,500 per month. And let's say we're in our 80s and he passes away. So if he were to pass away first, I'm going to drop the benefit I get on my record. So I'm going to drop that 1,500 because you can't get both, and I'm going to start collecting what he was getting. So I'm going to start collecting that full $2,000. And because I'm past full retirement age, I get 100% of what he was getting at his time of death. Now, let's say I were to pass away first. He's not going to start collecting my benefit because it would be less money. So again, if you are full retirement age or older, and you're the surviving spouse, you would receive 100% of what the deceased spouse was getting at the time of their death. Now, some individuals, go ahead.
We have a couple questions. How would you find out if you're eligible for half of your spouse's Social Security and what the amount would be?
So one thing that I'm going to talk about a little bit later on is creating a My Social Security account. And if you haven't done so already, I would highly recommend doing so. If you go to our website to create the online account, that is how you will get benefit estimates of what your retirement benefit would be at different ages. And you can play around with it. So you can, get an estimate for different ages or different dates that you want your benefits to start. You can get estimates on what your spouse could receive or any potential survivor benefits. So if you're married, you and your spouse would each want to create one of those My Social Security accounts. So you could look at the numbers and see if your spouse would be eligible for a benefit off of your record.
So they're asking, like, I think what they're saying is, how do they find out they're divorced from that spouse and don't have any contact with that spouse, and then they want to get half of their benefits? How do they find out if their amount's greater than the amount they already were?
Okay.
Yeah.
I understand now. So when it comes to a divorce situation, the only way to get that information would be contacting your local Social Security office. So when you file for benefits, you have to file for your own benefits first before we will look at any potential benefits you could receive as a spouse or as an ex-spouse. So if you were to call the local office and just say, I'm wondering, am I going to get benefits as an ex-spouse? They probably won't give you that information unless you are filing for benefits on your own record as well. When you file the application, one of the questions that we ask, or there's a whole line of questioning that we ask about marriage. If you're currently married, if you've ever been married, it'll go through, lots of different questions in order for the local office to see if there is any potential entitlement to other benefits for you. So at the time that you file, if you are eligible for a benefit off of an ex-spouse's record, we could look into that for you. I know we would need, if you don't have their Social Security number, we would need the person's name and date of birth to access that information. We also would ask for a copy of the marriage license, or a certified copy of the marriage license, and the divorce decree as well.
Thank you. Next question. Wife is drawing at 62 off her earnings. When I reach full retirement, does her benefit adjust to spousal benefits?
So she will keep receiving her own benefit that she's getting off of her own work record. But when you file, if she is due an additional spousal benefit, she would start receiving it at the time that you file. So it doesn't just switch over to the spousal benefit. She'll keep getting her own, but then she could be due an additional amount off of your record.
Okay. And next, a person was married twice, 10 plus years to the first spouse and less than 10 years to the second. Is it correct that this person would then be entitled to spousal benefits from the first spouse, even though he or she was married a second time?
It depends on, so if the second marriage, as long as they're not married now, if they're still not married, if they're the second marriage, if that ended in divorce, or that, let's say that person passed away, yes, then the individual could be entitled to a benefit from that first marriage.
But if they're remarried, then they don't, if they remarried a third time?
So if they are currently married, they cannot collect a benefit from an ex spouse.
Thank you for clarifying that. Do you get survivor benefits if you remarry after spouse's death? So that answers that next question. You said you cannot if you remarry.
If well,
Go ahead.
with survivor benefits, it's different. So remarriage after the age of 60 is okay. If it's before the age of 60, then you would lose entitlement. But if you remarry after 60, then that's okay. But that's
Okay.
just with survivor benefits.
Okay, just for survivor benefits. Thank you. Do the estimates currently receiving when they go in and on the website and try to get their estimates include the military credits?
Yes, that's already included in your earnings record. Yes.
Okay. I think that's, oh, one more. Can your spouse collect your Social Security survivor benefit if you pass before you start collecting Social Security benefits?
Yes, your spouse would receive what you would get at your full retirement age if you had been collecting. So if you have never collected Social Security before and you pass away, your spouse is still entitled to a benefit off of your record. And the percentage that they receive is just going to depend on their age at the time they start collecting.
Okay. That's all the questions now. Thank you.
Okay. So, one more thing about survivor benefits is sometimes individuals are eligible for two different benefits. So, they're eligible for a retirement benefit on their own record plus a survivor benefit. So, someone could take survivor benefits as early as age 60 and then switch to retirement benefits on their own record as early as age 62, or they could wait until their full retirement age or wait even longer until they're age 70 if they want to, if that benefit rate is higher. Or a person could start collecting retirement benefits as early as age 62, then switch over to survivor benefits at a later date if that benefit rate is higher. So some individuals are able to, make that choice if they're eligible for both a retirement benefit and a survivor benefit. But one thing to keep in mind, which we're going to talk about next, is the earnings limits. And these limits apply to anyone that is under full retirement age that is collecting a Social Security retirement benefit, a spousal benefit, a survivor benefit. These earnings limits come into play. So these typically adjust each year. So these amounts are for 2024. And when we talk about earnings, we are only talking about income from work. So this doesn't include any sort of pension, any sort of VA benefit, that doesn't count. Any sort of IRA distributions, casino winnings, lottery winnings, none of that counts. We're just talking about earnings here. So if you are under full retirement age, and you're collecting Social Security, you can make up to $22,320. If you go over that amount, we are going to withhold $1 for every $2 you make over that amount. Now, the year you turn full retirement age, the limit significantly increases. So you can see the jump there to $59,520 for 2024. And if you go over that amount, we will withhold $1 for every $3 you make over that amount. Once you reach full retirement age, there is no limit. So you can make as much as you want, and there's no limit. If we look at the amount for individuals under full retirement age for 2024, so that first row there, let's say you are going to file for retirement this year, you're under full retirement age, and you're going to file in August, let's say. So if you've been working full time, from January through July, you have probably already made over that $22,320. So does that mean you cannot file for Social Security retirement this year? The answer is no. We have a special earnings limit rule that only applies during the first year you file, where we then look at the monthly earnings. So you can see that smaller amount in parentheses there, that 1860. So from January through July, we don't care how much you made because you weren't collecting Social Security. But starting in August until the end of the year, we do care. So if you're still working, you have to stay under that 1860. Otherwise, you're not your benefit. That's just for the first year that you file. The next year, you can make that 22,320 in 1 month, in 3 months, in 6 months. It doesn't matter. It's just that if you go over that amount, we're going to withhold $1 for every $2 you go over that amount. So let's say you go $10,000 over that amount. Then we're going to withhold $5,000 from your benefits. So if your benefit is $1,000 per month, that means we're going to withhold 5 months worth of benefits. A lot of times individuals will then ask, well, do I get that money back? And the answer is no, you don't get that money back. But what will happen is when you do reach full retirement age, we're going to do an adjustment on your record, and it's going to result in a higher monthly benefit. So you don't just get the money back, but the end result at full retirement age is when you will receive a higher monthly benefit for any months that we didn't pay you a benefit because of your work. When it comes to Social Security benefits and taxation, this is an IRS rule, and it's based on your combined income. And the IRS defines combined income as your adjusted gross income plus non-taxable interest plus half of your Social Security. That's what your combined income is. So if you file a joint return and your combined income is between $32,000 and $44,000, you have to pay income tax on up to 50% of your benefits. If it's more than $44,000, up to 85% of your benefits may be taxable. If you file as an individual and your combined income is between $25,000 and $34,000, you have to pay income tax on up to 50% of your benefits. If it's more than $34,000, up to 85% of your benefits may be taxable. Once you are collecting Social Security retirement benefits, you do have the option to have taxes withheld. However, you don't have to, but the option is there for you if you would like to do that. So before I transition into Medicare, I'm going to check back in to see if there are any questions that need answered at this time.
Yes. So what if you have a spouse who will be 70 and starts collecting, but the other spouse is only 62? How does that apply?
So it depends on the spouse that is 62. So if you're 70 and you're going to start collecting your Social Security, your spouse that is 62 does not have to collect benefits just because you do. However, if your spouse does start collecting and they're going to get a spousal benefit, it's going to be reduced because they're only 62 and they're not at their full retirement age.
And just to clarify, Hillary, you said in the first year, say that you worked like 8 months of the year and then retired when you turned 62, you don't get penalized that first year for the taxes for having to pay back. It's waived in the first year. Is that correct?
So we wouldn't withhold any benefits if you made over the earnings limit that first year for any month that you weren't receiving Social Security. So if if you're turning 62 towards the end of the year and you have already made over the allowable limit, it doesn't matter because you weren't collecting Social Security during those months.
Got you. And then option to withhold taxes, is that done online or do you have to go into the office? Also, do you know if Michigan taxes Social Security benefits as well?
Michigan does not tax Social Security benefits, and the option to have taxes withheld, there is a form that you can get the form online on our website. It's a voluntary tax withholding form. I think it's a WV4 is what it's called, but the name is voluntary tax withholding. You can get that on our website, and then you can either mail or fax it to the local office. When you get the form online, it will give you instructions on where to mail or send it. And basically, it brings you to our field office locator where you put in your zip code, and then the contact information will come up for that local office, including the fax number. So you don't have to go to your office to complete that tax withholding, and it's not available to submit online yet, but we're hoping by the end of this year, individuals will be able to submit those forms online.
And then last question, if they file for retiring, filing for Social Security, how long does it take to get your first payment of Social Security?
So it typically takes, well, we pay a month behind. So that's one thing to know. And the earliest you can file is 4 months in advance of when you want your benefits to start. So let's say I'm filing this month and I want my benefits to start. Let's see, what month is it? It's February, March, April, May. So I want my benefits to start in June. So if I file this month with my benefits, starting in June, that June payment is not going to come until July. Also, one thing to know, if you do file in advance, again, up to 4 months in advance is when you can file. You typically don't hear anything from us for a couple of months because when you're filing for benefits, it goes to a processing center, and our processing center is processing so many of these applications that, you know, if we know we have 4 months to pay someone, that one is just kind of going to sit there until it gets closer to the date that the benefit has to be paid. So you may not hear from us for a month or two. And sometimes that is a concern for people because they think, well, I filed for benefits. I haven't heard anything. It's been a month. It's been 2 months. But if you filed 4 months in advance, that's pretty typical to not hear anything for a couple of months.
And that's all we have right now. Thank you.
Okay, I am going to transition into Medicare. Social Security doesn't administer Medicare, but we enroll individuals into original Medicare, which is the Part A hospital insurance and the Part B medical insurance. If you wish to add a Part D prescription drug plan, a Medigap policy, a Medicare Advantage plan, you can certainly do so, but you enroll in those plans outside of Social Security. So again, Part A and Part B, you enroll through Social Security. If you do want like a Medicare Advantage plan, you do have to enroll in Part A and Part B first before you can get one of those plans. So you do contact Social Security first to get enrolled into the Part A and the Part B. One thing to know is you cannot enroll in Medicare just whenever you feel like it. There are certain enrollment periods, which I'm going to cover. If you are already receiving Social Security when you turn 65, so 65 is when you become eligible for Medicare. If you're already getting Social Security at age 65, you don't have to do anything. it's going to be automatic. Typically, about 3 months before your 65th birthday is when you'll get your Medicare card in the mail, and you don't have to do anything because you're already getting Social Security. It's automatic. But if you are not receiving Social Security and you are turning 65 and you need to enroll in Medicare, then you can enroll during the initial enrollment period. And that's basically a 7 month period. It's 3 months prior to your 65th birthday, the month you turn 65, and 3 months after. That's when you can enroll into Medicare Part A and Medicare Part B. Medicare Part A is free. Medicare Part B has a premium attached to it. So when you enroll during your initial enrollment period, you can enroll in just Part A, or you can enroll in Part A and Part B. You may not need either of them, or maybe you decide to enroll in Part A, but you don't need Part B. You know, it's going to be a little bit different for each person. You do not have to be collecting Social Security to enroll in Medicare. So you would just file for Medicare only. You do not have to get Social Security in order to file for Medicare. Sometimes individuals, they think, well, there's a premium attached to Part B. So I'm working and I'm covered through my current employer's healthcare plan, or maybe you're covered through your spouse's current employer's health plan and you're paying for that. So you may think, well, I don't want to pay for the Part B premium because I'm already paying for healthcare, so I don't need it. You want to check with the HR or the benefits person to see if Medicare is going to be primary or secondary. And if your insurance or the insurance you have through your spouse's employer is going to continue to be primary, then you likely do not need to enroll in Part B. You could enroll in Part A. It's free, but one thing with Part A is that when you enroll into Medicare, you can no longer contribute to a health savings account. You can still use the funds in a health savings account, but you can't contribute to the HSA any longer. So sometimes individuals choose not to enroll in Part A or Part B because of that reason. They have a health savings account and they have coverage through their current employer or their spouse's employer, so they're going to wait. And that's fine to do. Then you can enroll during the special enrollment period. So this is for individuals that are 65 or older and covered under a group health plan based on your or your spouse's current work, meaning you can enroll later when you're older, and because you've had coverage, there is no penalty for you. So if you're getting close to retirement or your spouse is getting close to retirement and you're going to lose that coverage, that's when you want to contact Social Security to sign up for Medicare Part A and Part B. There's a couple of forms that you complete. One of the forms we would have your employer complete. There's a small section for your employer to complete just to verify that you did have coverage. We'll get you signed up. There isn't any sort of penalty, and you'll be enrolled in Part A and Part B. Now, some individuals don't enroll in Medicare when they should, and they didn't have any coverage either. So for those individuals, they can enroll during the general enrollment period, which runs January 1st through March 31st each year. However, there could be a penalty attached to that. So for every 12 months that has lapsed when someone should have signed up for Medicare and they didn't, there is a 10% penalty. And that penalty is for the Part B and the Part D, and that sticks with you for your entire life. So it's important to know those enrollment periods and to know, when to sign up for Medicare. The Part B premiums typically increase each year, or I should say they change each year. It's a lot of times it's an increase, but not always. These amounts are for 2024. So the standard Part B amount for 2024 is $174.70. The Part D prescription drug plan, the amount that you pay, it's just based on whichever plan that you choose. Higher wage earners do have to pay higher premiums. So for the standard premium, the $174.70, individuals with a modified adjusted gross income of $103,000 or less, they pay the standard premium. Married couples with $206,000 or less, they're paying the standard premium. The next bracket down, there's the standard premium plus an additional $69.90 per month. And you can see, I won't go through each category here, but higher wage earners do pay higher premiums. We base the premium amount on the tax return filed 2 years prior. So if your income is changing each year, the amount that you're paying for your premiums may be changing as well. And when it comes to Medicare and TRICARE, Social Security doesn't really get involved with the way these two programs work together. So if you did have questions on Medicare and TRICARE, we would have to refer you directly to Medicare or to TRICARE to a different agency. But I did pull a little bit of information that I found. And that is, once you have both Medicare Part A and Part B, you automatically receive TRICARE benefits under TRICARE for Life. And TRICARE for Life benefits include covering Medicare's coinsurance and deductible for services covered by Medicare and TRICARE. Medicare Part C and Part D is not required. And TRICARE for Life is an individual entitlement, so coverage is only available for the Medicare and TRICARE for Life eligible beneficiary, and it doesn't extend to family members. So if your spouse is younger than age 65, the spouse would remain eligible for TRICARE Prime or TRICARE Select until they turn age 65 and become eligible for Medicare Part A and Part B. And Medicare is the primary payer. TRICARE for Life is the last payer. When it comes to questions?
Couple questions on that, yes.
Okay.
So someone who is of age and gets Social Security and Medicare, but the wife's never worked outside of the home, and she's going to turn 65, will her Medicare simply come out of his Social Security or the spousal benefit, or how will that work?
So it would come out of the spousal benefit. If someone is not receiving Social Security, but they have Medicare, then Medicare will bill them directly. But if someone is receiving Social Security or a Social Security spousal benefit, so if the wife has never, worked out of the home and she's collecting benefits as a spouse, when she turns 65, then the Medicare premium would come out of that spousal benefit that she's receiving.
Okay. And just, I think more common is someone has said that in an instance, the health plan requires that you enroll in Part A and Part B, or you'll be terminated. And TRICARE is an example of that you'll be terminated if you don't enroll in Part A and Part B for Medicare. That's what they said.
Okay.
I have Part A. I will be retiring in June. When do I need to add Part B? I am 66.
So you would want to add Part B. You actually have an 8-month window from the time your coverage ends to file and get Part B. And then you wouldn't be penalized. So once you retire and your coverage ends, if you didn't file for a few months, that would be fine. You wouldn't be penalized for that. But if you want the coverage right when you're the Part B, right when your coverage is ending and you're retiring, I would say you would want to contact Social Security about a month or two prior to when your coverage is ending to complete those forms to ensure that Medicare will start the month that you want it to.
Thank you. That's it.
So if you are going to apply for benefits, all applications are available online with the exception of survivor benefits. But if you're filing for retirement or just Medicare or only Medicare Part B, spousal benefit, disability, all of those applications are available online. However, you do not have to complete the application online. You can schedule an appointment to complete the application. Someone from your local office would do the appointment with you. And when you call to schedule the appointment, you will have the option to make it over the phone or to make it in person. So you can choose whether or not you want to do a phone interview for the appointment, or if you want to go into your local office on the scheduled day and time to complete the application. I don't recommend just walking into your local office and saying, oh, I'm here to file for retirement benefits without an appointment, because most likely they're just going to schedule an appointment for you and you'd have to come back a different day, a different time. So if you don't want to file online, definitely schedule an appointment to do so. The exception to that is survivor benefits. Because that application isn't available online, you could just go into your local Social Security office and file for survivor benefits. Again, the earliest you can apply for retirement benefits is up to 4 months in advance, and we always pay benefits a month behind. I talked about the My Social Security account earlier. It's an online account where you will have access to all of your personalized information. If you haven't created an account already, I highly recommend doing so. When you go to our website, ssa.gov, to create the account, you're going to be redirected to login.gov. If you Sometimes people get tripped up a little bit, because when you go to login.gov, that's our credentialing partner. That's how we verify your identity. And sometimes people get a little confused because they're putting in all this personal information into login.gov. But it's legit. You just follow the prompts and you'll have a My Social Security account. You'll get an activation code texted or emailed to you so you can create that username or password. If you already have an account with login.gov or id.me, you can sign in through login.gov or through id.me in order to get access to your My Social Security account. But you can't go directly to login.gov or id.me. You would have to go to ssa.gov. Sign in or create an account is the option. And then when you get to this screen here, you would select sign in with login.gov or sign in with id.me. If you are receiving benefits and you have an online account, you really can do business with Social Security online without having to contact the local office or call the local office. You're able to get your payment information. You can get a benefit verification notice, a verification that you have Medicare. You can change your phone number, your address, get a replacement Social Security card, a replacement Medicare card. There's really a lot of good information in there, and a lot of things that you can do online instead of calling the office or going into the office. And if you are not receiving benefits, this is how you can get estimates of what your benefits will be at different ages or dates of when you want to start receiving benefits. You can view possible spouses' benefits. You can get a replacement Social Security card. Once you file for benefits, you can check the status of your application. This is also where you will get your Social Security statement. So this is something that we used to mail out to everyone, which we no longer do. You can get this Social Security statement through your My Social Security account. The first page has lots of different benefit estimates, and then the second page shows your earnings record. You want to make sure that you check that earnings record periodically, especially for any years there that show a zero and should not, because any benefit that you get from Social Security is based on how much you paid and worked and paid into Social Security. So if there is a year there that shows a zero and there shouldn't be a zero there, we would want to either get a W-2 or a tax return from you so we can see what your earnings were and get those posted to your record, because that could make a difference in your benefit amount. If you have a My Social Security account, you can upload that information and you can make the correction online. Otherwise, you would just reach out to your local office and provide that information to the local office, and they could post that for you. When it comes to contacting us, of course, we have a lot of good information online. You can file for benefits online. You certainly don't have to. We also have our 800 number. I think the 800 number is great if you have general questions or to schedule an appointment. Calling the 800 number is good. We have extended hours in comparison to the local field office. But anything more complex, I would contact your local office directly. So, for example, you cannot get estimates for survivor benefits online. So if you wanted an estimate on survivor benefits, that's something that's a little bit more complex. I would call the local office rather than the 800 number. But I will leave this screen up here and I will check back in to see if we have any questions.
No, we're all set. Thank you for answering them as we went along.
Okay.
And just so everyone knows, you can send me a Teams or a message and I can get you a copy of the slides. And it is being recorded today. It will take some time to get the closed captioning done on it. And then it will be downloaded onto the MWR Battle Creek website, and you go to quick links and you should see it up there, but it'll probably be a week or two before it's done. We're hearing awesome training. Thank you so much, Hillary. There's so much good information and so many great questions as well. So thank you everyone for coming today. Sorry for the confusion on not having Hillary in person. She wanted to be here in person and we wanted to see her beautiful face now that we're all back in the building, but hopefully next year. Social Security will not cut your funding.
Well, thank you so much. I hope everyone has a great afternoon.
Thank you. Yeah, lots of thank yous coming in, Hillary. So someone wants the local office number. I don't think there's a local number anymore, is there? It's all 1-800 number.
You can actually go to our website. If you go to www.ssa.gov/locator, put in your zip code, and then the contact information for the local office will come up. Some of the offices do have their direct number. Some of them only show the 800 number. And I think it just depends on the size of the office, the staffing level of the office. But a lot of our local offices do actually have their direct office number available.
Okay. If there's any complicated questions that you feel like you didn't get answered, you certainly can send them to me and I can send them to Hillary and we can try to explain better. We tried to get as many as we could, but certainly if you didn't feel like your question was answered fully, then just send me a message and I will get a response back from Hillary. Thank you guys so much. Hillary, thank you. Have a great day. Thanks for being with us. Take care.
Thank you. You too.
And bye-bye.